Hi guys, Dr. V here. So as promised, since we're in the middle of our fertility series this week, we did a little bit of a Q&A, so thanks for submitting your questions. So the first question I got was, you mentioned blood sugar issues. Is that for someone who has diabetes or is it pre-diabetic? It's a really good question. So a lot of the times somebody will come in and they'll have blood sugar issues. And what I mean when I say that is that they'll have signs and symptoms that present like blood sugar issues. So they'll have hypoglycemia or hunger, as we like to call it in this society. They'll have low back pain, they'll have fatigue, sleep issues, digestive issues. On average, it takes about 10 years in this country to diagnose diabetes, and that's too long. So we kind of look at clinical presentation, muscle testing to be able to identify blood sugar issues. So it's not just for diabetics, it's for people who might struggle with their blood sugar regulation as they go along. So the second question is, what can I do to have healthy blood sugar levels? Again, a really good question. So something that I do in the office is that we do a muscle testing and acupuncture correction for blood sugar, which kind of resets the circuits, gets you going on the right track. At home treatments, I recommend my patients doing sort of a specific diet. Again, it varies case by case. So somebody as a diabetic coming in versus somebody just having signs and symptoms varies a little bit. So somebody that's on the extreme spectrum of having diabetes would obviously not be able to have sugar, have a more limited diet than somebody that's coming in and just having certain signs and symptoms. As you get healthier, we kind of reintroduce some of those foods, but again, it's a case-by-case basis. And you want to be treated individuals because you are an individual and have specific genetics and environmental predispositions, etc. So the last question I want to address is, we talk a lot about females. Should both partners be treated for fertility? Absolutely. So in my last blog post, I kind of addressed that a little bit, but you need both viable sperm and egg in order for fertilization to occur. So if we're just treating the females and we're treating all of their hormones and things like that and getting them healthy, that's amazing. However, if the sperm is not, healthy, then we're not going to have a good fertilization, which won't lead, obviously, to pregnancy. So, and we're starting to see trends in this country of males having estrogen-dependent diseases. So, things like gynecomastia, man breast, things like that. So, it is more and more important that we address male hormones as well as females in these cases. So if you guys have further questions, go back and read the different blog posts that I posted on drveronikavlasov.com. If you have questions, we'd love to hear from you guys. Have a great day.